Here's a statistic that should terrify you. 9 out of 10 people who experience cardiac arrest outside of a hospital do not survive. But here's what should inspire you. If just one person nearby knows basic first aid, their survival rates can double or even triple. I'm Chris. I'm a 5th-year MD PhD student, and today I'm going to teach you 5 essential first aid skills that could literally save someone's life. We're talking about the difference between someone living and someone dying while waiting for paramedics to arrive. By the end of this video, you'll know exactly what to do when someone is choking, having a heart attack, bleeding severely, or showing signs of a stroke. And here's the thing, these skills are so simple that kids as young as 9 can learn them effectively. So let's jump right in. First up, hands-only CPR. This is the #1 skill everyone needs to know because cardiac arrest can happen anywhere, anytime. Every year, 350,000 Americans experience cardiac arrest outside of a hospital, and currently fewer than half of those receive the immediate CPR care that they desperately need. Here's the brutal truth. Every minute without CPR, someone's chances of survival drops by 10%. Just after 5 minutes alone, brain cells start dying. But if you start compressions immediately, you can double or triple their survival chances. The 2024 guidelines are crystal clear on this. Step 1 of 4 is to check for responsiveness. Tap their shoulders firmly and shout, "Are you okay?" Step 2, call 911 immediately or have someone else do it if you're performing CPR. Step 3, position yourself, kneel beside them, place the heel of your hand on the center of their chest, right between the nipples, and place your other hand on top, interlocking your fingers. And lastly, step 4 is push hard and fast, at least 2 inches for adults at a rate of 100 to 120 compressions per minute. Think of the beat Staying Alive by the Bee Gees. Don't worry about rescue breaths if you're untrained. Continuous chest compressions are what matter the most. Keep going until paramedics arrive or the person starts breathing normally. You will feel tired, and if you cannot no longer do compressions, have someone alternate in your place. The key is don't be afraid to act. Broken ribs heal and dead people don't. For the second skill, the choking or Heimlich maneuver, choking is the 4th leading cause of an accidental death in the United States, claiming about 4,700 lives annually. But the Heimlich maneuver has a 86.5% success rate when performed correctly. Here's how to recognize when someone is choking. That person cannot speak, that person cannot cough, that person cannot breathe. They might clutch their throat, and that's the universal sign for choking. For adults and children over 1 year, you take 3 steps. Step 1, you stand behind them, wrap your arms around their waist. Step 2, make a fist with one hand, place it just above their navel, their belly button, and below the rib cage. Step 3, grasp your fist and with the other hand deliver quick and upward thrusts, 6 to 10 sharp movements. For infants less than 1 year, you do something differently. You hold them face down in your forearm, supporting their head, and deliver 5 firm back blows between their shoulder blades. A critical point is if the person becomes unconscious, lower them to the ground and start CPR immediately. The chest compressions can actually help dislodge the object that's causing them to choke. After successful treatment, always seek medical evaluation. Sometimes the maneuver can cause internal injuries that need immediate attention. Skill 3, severe bleeding. Severe bleeding can lead to shock and death within minutes. The 2024 American Heart Association guidelines emphasize immediate and aggressive bleeding control. Here's the priority sequence. Step 1, ensure that the scene is safe. Protect yourself first. Wear gloves if available. Step 2, apply direct pressure. Use a clean cloth, a gauze, or even your bare hands if nothing else is available. Press firmly and directly on the wound. Step 3, don't remove blood-soaked materials, just add more layers on top and maintain that pressure. Step 4, elevate if possible. If it's an arm or a leg, raise it above the heart while maintaining pressure. Step 5, for life-threatening bleeding that won't stop, apply a tourniquet if you know how to, or continue direct pressure while calling for advanced help. Skill number 4, stroke recognition using the FAST method. Every 40 seconds, someone in the United States has a stroke. But here's the critical part. Stroke treatment is incredibly time sensitive. The FAST method can help you recognize stroke with high accuracy and potentially save someone's brain function or life. F in the FAST method stands for face. Ask them to smile. Does one side of their face droop? Is their smile uneven or lopsided? A stands for arms. Ask them to raise both arms. Does one arm drift downward? Can they keep both arms up? S stands for speech. Ask them to repeat a simple phrase. Is their speech slurred? Is it garbled or strange? Lastly, T stands for time. If you see any of these signs, note the time immediately and call 911. In addition, you should always check for signs such as severe sudden headache, sudden vision loss, sudden loss of balance or coordination, and sudden confusion. Make note of these. In addition, timing is critical. As I've said before, stroke treatments work best within the first few hours. Every minute counts because that's brain tissue. Your role is to get them to the hospital as fast as safely possible. Do not drive them yourselves. Call 911. Paramedics can start the treatment en route and notify the hospital to prepare the stroke team. Lastly, skill number 5, basic wound care. Most injuries you'll encounter aren't life-threatening, but proper wound care prevents infection and promotes healing. For any cuts and scrapes, just follow these steps. Step 1, stop any bleeding with direct pressure. Step 2, clean your hands and then rinse the wound with clean water. Step 3, apply an antibiotic ointment if you have one. And step 4, apply a sterile bandage. In addition, if you have a wound that can't be cleaned properly, like a dirty wound, this requires tetanus evaluation because tetanus is a bacteria that can grow in the deep tissue. And it's important to have your vaccine up to date if you don't have one already. When do you call 911? Let me be crystal clear about when to call 911 immediately. If you have someone that's unconscious or unresponsive, call 911. If you have someone that's difficulty breathing or no breathing at all, call 911. If you have severe bleeding that won't stop, call 911. If you have signs of stroke or heart attack, call 911. If you have severe burns, call 911. If you suspect spinal injury, call 911. If you have poisoning or overdose, call 911. When in doubt, call. It's always better to have paramedics assess someone who doesn't need transport rather than to delay the care of someone who actually does. Here's what I want you to remember from this video. You don't need to be a medical professional to save lives. These 5 skills, hands-only CPR, the Heimlich maneuver, bleeding control, stroke recognition, and basic wound care are your toolkit for emergencies. Practice these skills. Take a CPR class through the American Red Cross or the American Heart Association. Get certified. Your confidence in an emergency will come through preparation, not panic. And share this knowledge. Send this video to your friends and family. The more people who know these skills, the safer our communities become. So I would recommend that you take one skill from today's video and practice it this week. Look up local classes because the life you can save could be someone you love. What questions do you have about first aid? Drop them in the comments below and I'll address them in the future videos. My goal is for this channel to reach 20 subscribers. Until next time, stay prepared, stay confident, and stay ready to help. Thank you.